Thank you for calling Dr. Byrd's office. This is Stephanie.
Dr. Steve Byrd has been a plastic surgeon in Dallas since completing his residency nearly 30 years ago. Today, he's a member of the Dallas Plastic Surgery Institute, along with 8 of the most renowned and respected plastic surgeons in the country. One of Dr. Byrd's commitments to his patients is to look for new and better ways to improve every aspect of what he does, including technique.
I became concerned years ago that the standard facelift that would put an incision around the ear and pull to the side really wasn't going in the direction that gravity created. And so if I listened to my patients, most of them, I'd say, well, what are you looking for? So many would take a single finger and put right here and pull up. They didn't do this. So I began to look at that as a calling card to how can we do that. And some things happened. Endoscopy got introduced in 1995, and I saw then the opportunity for a very small incision in this area, and working underneath. The incision around the ear, however, was very powerful for correcting the jawline and neck. The thing that evolved from that was a procedure in, say, someone who had just started aging, where they wouldn't even have a scar visible in their face, done endoscopically, to the patient who has more advanced involvement of the lower face and neck, where you combine the two. The procedure that I was fortunate enough to develop was really an endoscopic, what we call mid-face lift, which deals with this upper third zone, and then how you entwine and incorporate that into the look that needs to happen along the jawline and neck.
To show you how effective these procedures can be, take a look at Dr. Byrd's patient, Sherry.
She came to me at a point in her life where there was crisis. She was concerned not only about aging around her eyes, but also in her neck. She was looking to sort of have a change, not only in her physical appearance, but in her life. We decided that to make her look 10, 15 years younger, we really needed to address the entirety from sort of the forehead down to the neck. So in her particular case, we combined the endoscopic procedure with a procedure that tightened the neck and jawline.
It was just amazing. I was just shocked at how easy it was. The minute I got all the bandages off, I could see my whole face, and I thought, oh my word, all those wrinkles are gone. I would never go to anybody else, ever. It's just amazing. The whole place, every person that I have come in contact with were the sweetest, nicest people.
I have always had bad acne and was more interested in fixing acne scars. But he did more than that. He is a delightful person, very kind and sweet, takes lots of time with you.
He's one of the most caring doctors that I've ever seen in my life. He cares about the person, and he just goes over and beyond.
Felt great for people to come up and say, you know, wow, you know, you look fabulous, and you don't look different. You look the same but better.